another episode of Quiérete. Thank you for coming back. We have another special episode for you all for today. And so, as you can see, today we have yet another guest. So, I'm really happy for her to be here because we've been trying to record this episode for a few months already, but things happen, right? Life happens, so it hasn't. We haven't been able to record an episode, but she's here today, and so today's extra special because she is my sister. So I'll go ahead and let her introduce herself.
Hello, everybody. My name is Daniela, and I am obviously her sister, and I'm very happy to be on her podcast today.
Yes, so Daniela is my little sister. So I brought on my brother already, but I've been wanting to get her on here too because her and I have tons of mental health conversations as well, and so we can very much relate to a lot of mental health topics as well, and so I thought it'd be great to have her on here and have her share her story as well, and someone can resonate and then be able to connect with what she's going to share as well. So without further ado, let's go ahead and get started. All right. Daniela, so let's start off by talking about just the topic of mental health in general. What is that word? What do you think about when you hear the word mental health? What's the first thing that comes up for you?
I would say some type of disability in your head, your brain not functioning how it's supposed to be functioning. I would say that's what comes to mind.
Okay. All right, so I know there's a difference between mental illness, right, and mental health, right? So I think a lot of the times, a lot of people think about well, there's something wrong with this person, right? Or there is some impairment in their functioning as well. So that's interesting that you say that as well, right? Because I've said in previous episodes, I think a lot of people have different perspectives on what mental health means to them as well.
Of course.
So do you think that mental health has played a big role in your life?
Most definitely. I feel like mental health is the core of how we behave, how we socialize, how we pretty much function in everyday tasks.
Yeah.
I feel like if you have a day where your mental health is a little bit off, it kind of just it just kind of makes your day a little bit different. It just depends how you see it. That's why it's very important to take a look at mental health in a positive way, where it's not a bad thing. It's just something that happens, I guess.
Mm-hmm. Yeah. So. And I've always explained to people that mental health is just like physical health, right? And so when we have a persistent stomach ache that doesn't go away with Pepto-Bismol or I don't know, Mylanta or something like that, if it doesn't go away on its own, then you're going to go to the doctor, obviously, right, to see what's going on, to get to the bottom of it. And the mental health too, right? If you start feeling different and you don't feel like yourself anymore, then it's okay to go and seek support as well. So all right. So can you share a little bit about your journey with mental health and how it has impacted your life?
So I obviously suffer from anxiety. I've had depression in the past. I was diagnosed recently with ADHD. I have had so many different symptoms that it's hard to really go into detail and say how I felt with every, I guess you can say, disorder that I was diagnosed with. But it definitely was very challenging. I have taken medication. I've gone to therapy. I've tried, what is it called with the needles? The acupuncture.
Yeah.
Just different things, meditation, exercise, and I feel like it just made me a stronger person in general, because I feel like if I can overcome obstacles with my mental health,
mm-hmm.
I can overcome a lot of different things.
Yeah.
And I think my illness, not illnesses, but my mental disorders don't define me as a person. It's just something that is a part of me, and yeah, basically my mental health journey has taken me very far, and I've learned a lot about mental health in general.
Yeah.
And I feel like if I didn't have whatever I had, what I've gone through, it wouldn't make me the strong person I am today.
Yeah.
So
Yeah, that's very brave and like very courageous of you to say that as well, because like it's not an easy topic to talk about and be open about either, right?
of course not.
Yeah, and like you said, like you found the good and the positive through all of it, even though sometimes it can get very challenging, right? Because mental health, like that's the thing about mental health, like some days are really good and then some days are really bad too.
Of course.
Yeah, and so and I can testify to that too, right? 'Cause she's my sister, and like we spend a lot of time together as well, and we connect with each other a lot too. So I've seen like the good and bad, and it's kind of like a wave, right? Where it's like sometimes it's just like this too, and it can become like a cycle as well. But okay, so do you think that, or actually let me rephrase this, but do you feel like you became familiar with your mental health or the status of your mental health like as an adult, or did you recognize that like your mental health was maybe not at its best when you were a kid? When did you start recognizing?
I would have to say, as a kid, I knew something was off with myself. I knew that I had this weird feeling inside. I always felt it in my chest area. That's the part in my body that I felt like was very tight, and I just felt like I couldn't function, and it was so weird. At first, when I was diagnosed with, I think it was like panic disorder. Prior to that, the doctor had told me that it was some type of like high blood pressure problem that was causing the issues. And we couldn't really get to the root of what was causing my hypertension.
Yeah.
And so it kind of correlated with my anxiety, because obviously when you're anxious, when you're nervous, you tend to, your blood pressure obviously goes up. So that was something kind of interesting. And then as I, grew up, I started learning more about like the common symptoms, like the sweating, the dizziness, the, everything else, all the good stuff that comes with anxiety. So I'm like, oh crap, like I didn't know that, I have anxiety. And it's just saying the word out loud, like it doesn't scare me anymore. Before, like I would be embarrassed saying like, oh, I have anxiety, like okay, you freak, but really, who doesn't have anxiety nowadays? It's very common. So
that takes a lot of like just reflection, to get to that point as well, right? Where you can say these words without, like you said, feeling shame, right? Or feeling embarrassed about them too. And like you said earlier too, like how you said like it's not that like I'm not the disorder, right? I just have that disorder, right? So it's like I'm not anxiety, I just have anxiety, right? So that helps to create some disconnection too from the illness. But yeah, I mean, it sounds like you've become very, very knowledgeable too on like the symptoms. And then you said something important too about like how you like when you were like younger, you confused it with maybe just high blood pressure, because I do remember, right, when you would go to the doctor and then like, oh, pues tiene la presión alta, and we would try to figure out like, is it something that you're eating, like is it your diet, like what the heck? Because you were always very thin, right? You were super thin when you were a kid. And I think just from my experience too, and I can say this, right, because I'm in the field as well, and I've done clinical work as well, but like always do a medical rule out, right? So always rule out any medical conditions before you before you get like a mental health diagnosis too, because sometimes it could be that, right? Like thyroid can also cause anxiety. And so UTIs can also cause anxiety symptoms as well. So it gets kind of tricky sometimes, but all right. Well, thank you for sharing that, sis. And then, like, how have you found ways to cope with mental health challenges?
Xanax? No, I'm kidding. Well, I mean, technically I'm online. Medication. I do take medication for anxiety. Not all the time, but whenever I feel like I have pretty bad episodes of anxiety, I do, take my medication,
Yeah.
and a combination of just I haven't done therapy in a while, but I I would like to go back to doing therapy, getting therapy, and exercising is very, very good for my anxiety. Like, I feel as though after a good workout, my anxiety is almost like gone. So
Yeah.
that's something that is very important for those who struggle with anxiety. That exercise, as even if it's just getting out and going for a walk, that that can
Make a big
make
difference.
make a big difference in the way that you feel. And yeah, so exercise and eating healthier too. Obviously, I know when I eat like crap, my body detects it, and you know,
You feel
obviously I feel like very sluggish. I feel sluggish. I don't want to do anything. So I feel like that just that plays a role in it too. So yeah.
Yeah, so a combination of a lot of different things, huh? Yeah. So you mentioned like therapy, right? You mentioned medication as well. You mentioned like the use of exercise and also like just eating healthy, right? Which are all very important components as well.
Yeah.
Did you do medication before you did therapy, or did you do therapy before medication? How was that for you? When did you start?
No, I actually did therapy before medication. But
Do you feel
after
like that helped?
the medication,
The therapy.
the therapy did help. I feel like it was more how do you say, like physical symptoms that I experienced.
Yeah.
I'm not a very worrisome person. Like I
Yeah.
don't worry a lot. I don't really care about, okay, what is this gonna do, or what's gonna happen tomorrow. Like
Yeah.
I really don't give a it's just that I feel randomly anxious for no reason, and I feel like with the use of medication, I know a lot of people are not for it. I get it, I understand, but I'm for it. Like it's like you have a headache. Okay, well, pop some Tylenol. All right. Well, you have anxiety that you've tried so many different things to cope with it, and nothing has helped. Okay, it's okay. Maybe you will take like a Klonopin, Xanax, whatever it is. As long as you don't abuse it, is what is really important. So that has really helped. And yeah, I started taking medication when I was probably like in high school. I started antidepressants. I didn't really feel like they worked, so I stopped taking them. And then once I was maybe like in my mid-20s, that's when I started using more of the controlled substance like Klonopin, and I felt like that helped a lot. Obviously very low dosage, and I felt like I'm ready to go with that, and I'm totally okay. So
And then did you start off, so was a medication prescribed to you through like your primary care doctor, or did you go through a psychiatrist?
no, I actually went through a psychiatrist.
Okay.
Since they do obviously
That's
specialize in
specialty.
psychiatry and medication, so mental health, yes, and I trust my doctor very much. I've seen him for, I think it's been like 6 years already that I've been seeing him, and I can tell he really wants the best for me, and eventually, maybe I will stop taking medication, but for right now, I feel okay taking the same dose. I haven't highered it, I haven't lowered it, it's the same dose, but, it's, anything can change really from now on.
And medication's a very like controversial topic, right? Because some people are completely against it too, and then some people are like, no, like I'd rather do medication instead of doing therapy, right?
Course,
so usually it's like two different extremes, and then some people just want to do both too, and that usually advances like their progress as well, and reduces some of their symptoms. So I actually like so my sister, like, she knows a lot about different medications too, and it's interesting because right, like it's not like she works in that necessarily in that field, but it's been through her own experiences, right? And then going through psychiatrists too, and then the different therapists. Can you tell us a little bit about like what makes you like want to stop going to therapy?
what makes me want to stop going to
Yeah,
therapy.
because you've done therapy before,
I
but sometimes you're
have.
like, 2 weeks, I don't want to do it anymore.
I feel like I'm a person that if it doesn't work for me the first time, I stop.
Yeah.
So, for example, medication. It works first time. Okay, I'm gonna stick with it. If I find a therapist that I don't like, not that I don't like, I'm sorry,
Like you don't
that
connect with.
I don't connect and I don't feel very comfortable opening up to,
Yeah.
I automatically just stop seeing them. I guess I don't give them a chance.
Yeah.
So I don't know, that's something that I kind of want to better myself in and try to overcome that.
Mm-hmm.
But yeah, I've seen probably a good amount of therapists and I've tried a lot of different medications. I could probably name like 10 off of my head right now, but I'm not going to. So yeah.
That's another episode.
I know, right? Yeah. But yeah, I will give them a try because I have been looking up therapists and I guess it's just time too, but really at the end of the day, you're never too busy to take care of your mental health and have to set aside time for myself and to seek therapy. So
yeah, absolutely. All right. Well, I'm also wondering too, sis. How has your mental health journey like influenced like your career or like your personal goals?
So I feel like because other people have helped me through my mental health journey, I want to do the same as well. So currently I am working in a position where I'm helping inmates that have mental health problems, and I feel like I love helping people, no matter who it is. I love helping them in that aspect. And then also, as far as my goals, I feel like I said, like it made me strong, like my mental health made me stronger. So I feel like nothing can really get in the way of meeting my goals because I feel like I have gone through hell and back at times, and I feel like nothing really can stop me from meeting my goals.
Yeah.
I was also a special education teacher, and I would also teach students that obviously have disabilities. So I learned a lot about that, and just my background in general made me really be more empathetic towards people with mental health or disabilities or whatever it is. So so that's how it.
So then like mental health has played a big role in your life and has influenced greatly like the choices that you've made in your career and how you perceive your career. That makes me think a little bit about sometimes like, so I've encountered interns, right, that say like, oh, I don't know, right, for sure if like I want to continue like this field in mental health because I myself have had a lot of mental health struggles and a lot of trauma, right? Or I've had clients, like high school clients that I work with that say, well, I want to be a therapist one day, but because of the trauma that I've experienced and all the things that I've been through and my mental health is not at its best, I don't think I'd be a good therapist. But then I say, but then think about it, like you've lived it firsthand, like you've experienced mental health, like that creates a bigger sense of empathy, right? And then you're in a better position to sit across from that client or patient too and be able to connect with them and understand them in a deeper level as well. So that shouldn't discourage anybody, right, from wanting to go after their passion. But experiencing a lot of things at a young age just grows your sometimes it can grow your empathy and your compassion as well for other people who are going through similar things as well. So what do you think is like one of the biggest misconceptions about mental health like you would want to dispel? Like what's something that and this is probably something that we even hear from our own parents, right? Their views about mental health, some of our friends, but what is one of the things that you'd like to clear up?
So a big misconception would be mental health, having anxiety, having depression, having whatever it is, shows a sign of weakness, shows a sign of vulnerability. And to be honest with you, I feel like those who do suffer from these conditions are the strongest people because, you know, they speak up about it and they've gone through so many crazy symptoms. It's like, wow, like to be standing here still, like it takes a lot. And, you know, it's a journey pretty much. You're pretty much at war with yourself in your head. And if you can fight through that war, then you can fight through anything in life. And I think it's very important that people, you know, give themselves a pat on the back if they have experienced that before, some type of, you know, mental health illness, or, you know, they don't have to have really like an illness. They just experience anxiety. It could be whether like a divorce, a breakup, or whatever it is.
Stress in their life.
Yeah, like a situational type of anxiety or depression. So, so yeah, that, you know, I think that there is that big misconception. And no, you're not weak. You're not a little. I can't say it on camera, but you know. It's just dumb how people think that way, and I think it's like ignorance too, you know. Like obviously if they're scared of talking about something that is unknown. People are uncomfortable about talking about things that they don't know about, or it's a sensitive topic. Like they don't like to talk about it. So I don't know. I guess they're the ones that are the little, you know. Anyways,
It starts with the B and it rhymes with rich.
Rich, there you go.
But I think you said it very well said. I completely agree with you too. I think that's still a misconception that a lot of people have to this day. I think another one too, and I don't know if you probably heard it too. It's like, it's not like it's weak to cry too, right? Like, why are you crying? Like that's showing weakness as well, or even being able to express your emotions too, right?
Oh yeah, definitely.
So, you know, and a lot of the times, people, it's a lack of knowing, a lack of education sometimes too, unfortunately, right?
Yes.
Or some people are just scared of the topic too, right? Like they don't want to explore the topic either because there's a sense of fear as well in talking about it. But thank you for clearing that up. So hopefully people heard that first, right? It's a big misconception. It's not true.
Yeah.
All right. What do you think? I think friends and family can play a huge role, right? If we have positive relationships with them in the healing journey of someone who is experiencing mental health. But for you on a personal level, how has friends or have family, how have they helped you with your mental health, like struggles or challenges?
Well, you know, I feel like friends, they have been there for me, especially those who have experienced, you know, mental health issues as well.
Yeah.
Just relating to each other and, you know, knowing that you're not alone. Also, you have helped me tremendously with, you know, my struggles, because it's easy to talk to you about my own mental health issues and stuff, because you're very knowledgeable in that area. But even just hearing me out, you know, like to have somebody hear you, it could be like, you know, like it could be a friend, you know, family, anybody who is willing to listen to you, that can be like a huge, you know, relief. And I feel like my friends and family, they do really care, and it's important to, you know, keep that small circle too, because, you know, I don't go around saying, hey, I have anxiety, you know, like it's only, you know, a couple of friends that I can actually talk to about this. So, they're a great help.
Thank you for sharing that. So, I mean, it sounds like, then family and friends do play a huge, important role, and like to have a good solid support system can really go a long way too, right? And there are some people that don't really have that too, and they're kind of battling and struggling on their own, and that can get very lonely as well, which makes the their healing process even more difficult too. But yeah, of course, then that's, I always say too, like 'cause she's always there for me too, like if I have issues and struggles as well, and like, yeah, absolutely, just to have someone listen to you, like to lend an ear. Like sometimes I don't even have to say anything, it's just like, just listen to me and that's all I need, or just give me a hug and that's all I need to, right? Or just let me cry to you and vent to you, and that can be very helpful as well. So
Yeah.
um,
Yeah.
what about for people who are, because there's a lot of people, right, that are struggling with their mental health and they won't come forward. And so what advice would you give to those people who are struggling with mental health? Like where is a place that they can turn to for help? What would you advise them?
I mean, you could turn to me. You can honestly, like, I think really anybody that you feel that won't judge you, it could be like a sibling. You'd be surprised, like siblings can make fun of you or whatever, but at the end of the day, if you really like talk to them about something that's pretty deep, they're gonna listen, and you'd be surprised.
Yeah.
And the worst thing you could do is just keep it to yourself. And if you don't want to speak to somebody that knows you, you could always go online, just look up any therapist, anybody that is, certified, and, talk to them and, make an appointment. I think it's just the first step. People just don't know what to do, and that's something that impedes people from seeking therapy. So yeah, I feel like you should really do it, and if it comes to a point where you really just can't anymore, then just speak to anybody, honestly, because like I said, the worst thing you can do is keep it to yourself, and just know that you're not alone.
Yeah.
There are billions of people that are going through the same thing as you are, so
Yeah, you'd be surprised, right? How many people are actually struggling in silence as well. So
Yeah.
like my sister said, there's a lot of support, there's a lot of resources out there as well, and so there's a lot of hotlines as well. There's texting lines now as well, where you can text someone anonymously as well if you don't feel like you want to share this information with a loved one or a friend. So all right, sis, well, my last question for you is, what are some of the biggest lessons that you have learned this year, or just like in the past 5 years?
Lessons.
Or maybe something about yourself that you'd like to share.
Okay. I would have to say, alcohol. Drinking alcohol made me feel like crap. I think I learned that, I guess the beginning of this year maybe, but I haven't drank alcohol in a good while. I feel like it not only makes me feel bloated, it makes me feel like I get a hangover like 2 to 3 business days long, and it's like, oh my god, like it's not even worth it anymore.
Yeah.
So I guess because I'm getting a little bit older too, like my body is just saying like, what the heck, like what is going on, like I don't like this anymore. And plus, like, I feel like I can have fun without alcohol. So that's definitely something that I learned about myself, is that that's just not for me anymore. And something else that I learned about myself is that I'm a pretty freaking strong person, and really you can be a bad, that word again, and have anxiety.
That's fine, you can say it.
You can be a bad bitch and have anxiety at the same time. So, just as long as, you fake it till you make it, sometimes you just gotta act like you don't give a shit, and at the end of the day, really nobody cares, like, so you shouldn't care. So just live your life how you want to, and at the end of the day, you're gonna be really happy. So yeah.
Most importantly, right, just be happy with yourself, and
Yes.
that's all that matters as well.
Yeah.
So it sounds like you've had quite the journey, sis, too, right? And it continues as well, but it sounds like you've learned a lot about yourself, right, and what works for you, and also what doesn't work as well. And And so I appreciate you coming on here and sharing a lot about yourself,
I
right?
appreciate you having me.
Of course. All right, guys. Well, I think that's it for today. I love these mental health talks. And so hopefully you all, gain something from this, or if you're able to resonate as well, then we've made a little bit of a difference here. But yeah, till next time, I hope everybody has a great rest of their day. Bye.